Hi, this is Sagar Wagle, one of the musculoskeletal radiology fellows at Stanford University. We have a case of a 15-year-old male with acute onset back pain during a football game. Spine radiographs in general are insensitive for fractures, especially in the upper thoracic spine region where there is a lot of overlap from the shoulder tissue. In these radiographs, we see that the vertebral bodies have normal height and alignment, and we do not see any fractures. Let's look at the MRI of the patient and focus on T5 and T6 vertebral body. There is edema signal in T5 and T6 vertebral bodies, and when we compare these vertebral bodies to the T4 vertebral body, we can see that they have slight height loss. As we go from top to bottom in spine, the vertebral bodies should have similar or slightly increased size as we go below. So this patient has compression fracture of T5 and T6 vertebral bodies. I have another case of a 35-year-old male in a car accident. The vertebral bodies have roughly normal height and alignment, and again, the upper thoracic vertebral bodies are not well seen due to overlap from the shoulder. Let's look at the CT. As we scroll through the CT, we can see that there is fracture of the T5 vertebral body anteriorly, and there is also fracture of the posterior element of T5. And as you go to this image, you can see that the T5 vertebral body has slight height loss when you compare it to T4 vertebral body. And we can also see the spinous process fractures of T5 and T4. We can see the fracture on coronal image as well. On the CT, we could only appreciate the T5 vertebral body fracture, but when we look on the MRI, we see edema signal of T3, T4, T5, and T6 vertebral bodies. So this person has multiple vertebral body fractures. We don't always do MRI in case of compression fractures. If there are concerning neurological symptoms, or if there is meaningful retropulsion of the fracture fragments into the spinal canal, MRI would be helpful. The patient was treated with posterior rod and screw fixation of the thoracic spine. Thank you for watching the video.